Okay, here we are for the Board of Health meeting for Tuesday, July 14th, 2020. Calling this meeting to order. They even brought me the little gavel that I can bang. My name is Ty Menser. I am the chair of Thurston County's Board of Health. We have in the room 280 here at the courthouse, we have vice chair of the Board of Health. That's Commissioner John Hutchings. And we have Commissioner Gary Edwards, also our third member of the Board of Health. We have our Director of Public Health and Social Services, Shelley Slaughter, our County Health Officer, Dr. Dimiana Abdelmalik. We have Patrick Soderberg from Public Health, Environmental Division, Health Division. The Clerk of the Board of Health, Lydia Hodgkinson. We also have Jacinda Stelches from the Homeless Division of the Housing Services Division of our Public Health. And then, is it Mike Murphy or Mark Murphy?
Yes, Mike Murphy.
Mike, okay, great. And what? Thank you very much. I think that's who I've got. Ramiro Chavez as well, the county manager, also in the boardroom. So first thing we need to do is to approve today's agenda. Do I have a motion to approve the agenda?
Mr. Chair, I move to approve the Board of Health agenda for July 14, 2020.
Second.
Been moved and seconded. Any further discussion?
No.
All in favor, say aye.
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 Motion carries. We have an agenda. Second item is approval of meeting minutes from February 11th, March 10th, and March 12th.
Mr. Chair, I move to approve the meeting minutes from February 11th, 2020, March 10th, 2020, and March 12th, 2020 emergency meeting.
Second.
Been moved and seconded. Any further discussion?
Nope.
Hearing none, all in favor, say aye.
Aye.
Aye. Mr. Edwards was an aye as well.
Yeah. Yes. Yes.
Very good. That motion carries. We have an approved agenda and approved meeting minutes.
Now joining the conference.
Second item on the agenda is a presentation, something very exciting for all of us here, introduction of the new Thurston County Health Officer. I'm going to turn this to our Public Health Director, Shelley.
Good afternoon, Commissioners. It is my absolute pleasure to introduce to the Board of Health officially our new Thurston County Health Officer, Dr. Dimiana Abdelmalik. We're so happy to have you here, Dr. Abdelmalik. This is her first official Board of Health meeting, and I'm just going to share a little bit about her background and then turn it over to Dr. Abdelmalik to say a few words. Dr. Dimiana Abdelmalik was formerly an emergency physician with a great passion for public health. At the University of California at Berkeley, she studied integrative biology and history and spent a year in Cairo, Egypt, where she became interested in public health interventions. She continued her interest in public health as a medical student at Albert Einstein College of Medicine in Bronx, New York, where she was on the board of the free clinic and spent time contributing to public health in Ethiopia. She attended emergency medicine residency at Washington University in St. Louis, Missouri, where she continued her work in Ethiopia, teaching clinical providers procedural techniques using resource-appropriate simulation. As a global emergency medicine training fellow at Case Western University in Cleveland, Ohio, she worked with International Medical Corps on creating minimum standards for refugee clinics in the Middle East and earned a master in public health. For the past 3 years, prior to joining us at Thurston County Public Health and Social Services on July 1st, just 2 weeks ago, or not quite 2 weeks, she worked as a physician at Kaiser Permanente in Redwood City Medical Center in California, where for a year and a half, she led the HEADS-UP group, which uses a multidisciplinary approach to connect patients with complex medical and social needs with resources such as primary care, psychiatry, patient care coordination, and intensive case management. As you can see, she is extremely well qualified. We feel so fortunate to have her join us. It's been a joy to work with her. She's willingly and enthusiastically jumped into the deep end of the pool with us here in the middle of our COVID-19 pandemic and been doing a fabulous job. Looking forward to working with Dr. A, as she likes to be called, for many years to come. So welcome, Dr. Abdulmalik, and invite you to say a few words to the commissioners, to our Board of Health and the community.
Thank you, Director Slaughter. Good morning. Good afternoon, commissioners. I've had the good fortune to be the health officer here at Thurston County for almost 2 weeks. And it's been an extremely positive experience. We have a lot of challenges, particularly with regard to the COVID-19 pandemic, but with the team that we have here and with our community partners, it's been very invigorating working with everyone to mitigate the spread of COVID-19 and help keep the public here in Thurston County safe and healthy. Overall, my past 2 weeks, I have been extremely impressed with my colleagues here in Thurston County Public Health and Social Services. And I really look forward to working with everyone for years to come. Thank you.
Thank you. Would either of my seatmates like to have any words for Dr. A? Words of welcome.
Yeah, you know, I want to say something to Dr. A. I've only met you on Zoom, you know, and eventually I'm sure we will meet in person, but I would just like to point out that every time I've seen you, you have an aura about you that brightens the room. And I think that brings a lot to the game, if you will. Just your pleasant presence. And I don't know about anything else. I believe Shelley 100% when she says you're qualified and all that. And we obviously all agreed on that. But I just want to point that out, that you do bring a positivity with you. Thank you for doing that.
I'm glad you said that, because it's true. I haven't seen you in public. It's only been virtual, but you do. Your personality comes through the room, comes through the screen. And I hope everybody, I'm sure everybody's been very welcoming to you. You come with such credibility and such an impressive background that I'm very happy and comfortable and confident knowing that you're here taking care of us, guiding us through this pandemic. Thank you, Doc.
Thank you. Yeah, it's so interesting that we all had, one of my comments that I had jotted down was just the fact that your personableness and positivity just came shining through in the interview process, and even through Zoom. I mean, usually we have a full room at a Board of Health meeting, and some point, you know, so sorry that you don't get to kind of have that feeling of really addressing the public in the way that you normally would, but you can be sure that a lot of people are looking at this carefully. The health officer has never been in the spotlight, at least in recent memory, the way you are and your position is now. So you can be sure that the community is going to be paying attention, and we're very excited about that positivity you bring. I'm excited about the diversity of experience that you bring to the county. You know, as a fellow Berkeley grad, that shows me good judgment right out of the gate. So we can link arms against all the Huskies and Cougar fans that we have to fight with in the Pac-12. So you'll have an ally there, and yeah, I mean, you got a tall task in front of you, but you know we're behind you 100%. So thank you for coming aboard.
May I add one more comment, Mr. Chair? Am I
Yes,
unmuted? Hang on, there we go. I would just like to say, Doctor, you are here in Thurston County at this particular time for a reason. So I'm just very grateful that you're here. Thank you.
Chair, could I make one more comment too, sir?
Yes, sir.
I don't know how much the doctor knows about our form of government here in Washington, but I find it quite interesting that the 3 board members here, which we do not talk in the hallway or in the back room or in the boardroom about anything to do with business, because it's actually against the law in the state of Washington since 1972 for any 2 of us to discuss anything that has to do with county business. So for all 3 of us to come up with the same analysis and having never discussed it, I think it is quite remarkable, and really does point out that you bring that brightness with you.
Well said. 3 different generations.
Yeah, that's right. I'm the old guy.
Thank you, commissioners. It has been an absolute pleasure to be working with everyone here in this county to tackle this particular challenge. Thank you.
Now get to work.
Okay, thank you so much. And I neglected at the beginning of the meeting, and I know it's late, but I'll just say, if you need to call in through a landline for public attendance, we have 360-252-9020 available with a PIN code of 1234. Okay, so the next, yes. Next agenda item is the opportunity for the public to address the Board of Health. And I'm not sure how we're handling that. I don't see anyone on the camera, and I haven't been given a list.
I'll check if somebody has signed up. Give me just a minute.
Okay,
Ramiro, while you're doing that, did you want to say something to Dr. Damiano?
No, we don't have anything. Nobody signed up. No, Dr. A, I just want to echo what the commissioners have stated on the welcoming thoughts, and sometimes when we don't, at least for me, when we don't have the chance to meet a person in depth, we go by our gut feeling. That's probably what I have, and you certainly, I have a great gut feeling about you. Your positiveness and you always, a smiley face is always very welcome and reassuring on those difficult times. So following up, I will organize an in-person meeting for you to have the opportunity to meet in person with the commissioners. Obviously, all of us will be wearing a mask just to make sure that that is the case. And speaking of county government, as Commissioner Edwards stated, you and I have a 2-hour meeting Friday afternoon. You will hear me walking you through all about county government and county government 101. So Friday afternoon, I'm sure I'm going to put you to sleep, but hopefully we'll find that helpful.
Thank you so much. I look forward to it.
Yeah, I have nobody signed up for the public testing. Let me check on the phone. Is anybody joining us on a conference call who would like to testify? If you'd like to do so, please unmute yourself, introduce yourself, and give your name and the address where you live in the county. No, sir.
Okay. Thank you, Commissioner Hutchings. Didn't mean to forget you there, Ramiro. And sounds like we have no one to address the Board of Health, so we'll move to item 4, which is a consent item. A whole range of work session notes. Do I have a motion on that?
Ready for a motion, sir?
I'm ready.
The consent item.
Yep. I move to accept approve the consent items. A.
Second.
It's been moved and seconded. Any further discussion on this item?
No.
All in favor, say aye.
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 Aye. Motion carries. All of those work session notes are approved. Our 5th item on the agenda is our very interesting topic, integrated pest management prescriptions, specifically Blue Lake variable leaf milfoil and European coltsfoot. And it's better than it sounds. So I'm going to turn it over to Paula Cracknell, who is our lead on this issue.
Great, thank you. Hello, everybody. I'm here with Michael Murphy as well, who wrote the prescription for the European coltsfoot. And we are here to request approval of these prescriptions to treat variable leaf milfoil in Blue Lake. Variable leaf milfoil is a Class A noxious weed, and we are mandated by the state of Washington to treat this plant. And European coltsfoot is a new noxious weed on the radar for Thurston County. So this will be a new prescription, first time to treat this and to monitor it in our county.
Okay. Questions for Paula?
I have a question. Paula, you're not driving, are you?
No, I'm not. I'm in the field. We were out treating knotweed, so I'm in the town of Rainier. I came out here to attend this meeting remotely.
That's the beauty of a Zoom meeting.
Yeah.
Yes.
Well, I did a Zoom meeting with someone, and they were in the car, in the van, and I asked her, "You're not driving?" "Nope, I'm parked in the driveway. I have to get out of the house because of all the kids and the chaos and the dogs. This is the only time I get peace and quiet."
Yeah.
All right. I have no other questions, Paula. Thank you.
I do have a question.
Yes, Commissioner Edwards.
The prescription that's been designed, does that meet with everything that, say, the state does as far as their requirements and such to treat this plant with?
Yes, absolutely. The plant itself in Blue Lake especially is required for control, and the herbicide that we are choosing to treat it with is approved by Washington State.
Okay, thank you very much.
Mm-hmm.
Paula, the discussion we had the last couple of weeks talked about I believe it's like an advisory committee that weighs in, and can you describe that kind of process? And my understanding is there's some scientific expertise on that committee.
Yes, there is. Thurston County has an integrated pest management advisory committee, and the members of the committee are stakeholders basically in any prescription that we put through or treatments that we do. So the stakeholders are folks who are involved in agriculture or who are in other environmental interests, including state stakeholders or people who are actively serving on the Board of Health as citizen advisors.
Mike, I want to turn to you. We've had a lot of discussion about the milfoil, but Paula said you were involved with the coltsfoot. Is there an aspect of that you want us to be aware of?
Sure. Well, right now, as far as we know, it's eradicated in the county. What brought it to our attention was we found it on Skookumchuck Road last summer, and it has been present in the county before in the Mottman Road area. So we just want to be able to eradicate it as soon as we see it. We just want to be able to treat it.
Any other questions for Mike?
No, sir. Looks good.
Okay. Well, that was, we had if folks really want to dive deeper into this, they can look at our agenda setting meeting this morning at 9 a.m. We had an extended discussion about these issues. And so at this point, is there a motion?
Yes, sir. Excuse me. I move to approve the integrated pest management prescriptions for Blue Lake variable leaf milfoil and European coltsfoot.
Second.
It's been moved and seconded. Any further discussion?
No, sir.
All in favor, say aye.
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 Motion carries. Thank you very much, Paula and Mike and Patrick.
Thank you, commissioners.
Yep. Thank you.
Thank you.
Okay, excellent. The next item on the agenda, number 6, under department items, is a COVID-19 update featuring Shelley, our Director of Public Health and Social Service. Dr. Dimiana Abdulmalik, also online to help.
Thank you, Chair Menzer. I'm going to expand on information and share updated information information regarding what I share with the Board of Health when you convene jointly with the Board of County Commissioners every Tuesday at 9 a.m. We have been in response and have had our incident management team activated for 160 days. So I have been providing regular updates to the board, but this is the first chance that we've had the opportunity to share this in our regular Board of Health meeting. So since I shared with you some data this morning, those numbers have changed and increased. So I will we'll just dive in, and then Dr. Abdimalik has some information to share with you as well and answer any questions that you may have. So as this afternoon, statewide, there are 41,757 confirmed cases of COVID-19, 4,778 deaths, unfortunately. It seems like just such a short time ago that we last convened as a Board of Health prior to the pandemic, and we only had one case in the entire state of Washington, which was our first case in the nation. So in 160 days, that just shows how much COVID-19 has impacted our state as well as Thurston County. Since this morning, I shared with you, well, earlier this morning, I shared with you that we had 397 cases. This afternoon, we have added 15 new cases to that, for a total of 412 confirmed cases of COVID-19. Last week, there were 80 cases, the highest number of cases ever on record for us in Thurston County in 1 week. Unfortunately, we're seeing a concerning trend continue, although I'm happy that we have less cases today than we did the last couple prior days. So of the 412 confirmed cases, unfortunately, 5 of those have passed away. On the bright side, 277 are considered recovering or have been released from public health monitoring and isolation and quarantine orders. When we talk about recovering, we do not yet know the long-term health impacts of COVID-19, but we are glad that people are improving. Out of the 412, 39 have been hospitalized. Currently, on our hospital system dashboard that we monitor every single day, there are 12 COVID-19 patients hospitalized between Providence St. Peter Hospital and Capital Medical Center, our 2 major hospitals here in Thurston County. As I frequently share, of the 12 hospitalized COVID-19, not all of those are necessarily Thurston County residents. A case is confirmed to be a Thurston County case if the person resides and their permanent residence of record is in Thurston County. So sometimes we have cases reported or people hospitalized that are actually in other counties and other areas. And also we have neighboring counties that tend to seek care and the great healthcare services that we have here in Thurston County locally. Speaking of our hospital system, we do monitor our system capacity and readiness. Our hospitals reserve bed capacity in case we have a surge of COVID-19 patients that need care and stress our system. Our hospital currently has adequate staffing personnel to be able to care for our community, and they also report that they have adequate personal protective equipment, or PPE, for staff to provide safe care. So that is good news. There is available bed capacity. Our ICU beds are quite full. As of this afternoon, I just checked that update. So we continue to work very closely with our hospital partners and our healthcare system to make sure that we have adequate healthcare response available in Thurston County, and we do right now. In terms of testing, that's another metric that we evaluate. And to date here in Thurston County, there have been 16,934 viral tests for COVID-19 administered. Overall, since the beginning of our response, we have an average of 2.2% that have tested positive for COVID-19. We like to see that number under 2%, which is the target that we have for the state of Washington. However, in the recent weeks, with the increase, we're seeing that positive rate of tests increase to 3.1%. So that is a concern for us. We also want to make sure that we have adequate testing available in our community. And there's many things that we've been doing in Thurston County Public Health and Social Services to ensure that we have adequate testing access, that we have laboratory capacity that can support our community's needs, as well as testing supplies. We've developed some wonderful partnerships with our community health providers to ensure that testing is accessible. For example, our recent partnership with Providence St. Peter Hospital and Providence Health and Services of Southwest Washington. Together, we work to offer a drive-through testing site that is 100% free to people that need testing, and they can do so by accessing the drive-through at Hawks Prairie Monday through Friday. Encourage people to check our website for the latest hours and information regarding community-based testing. We're also partnering with one of our local federally qualified health centers, Valley View Health, to help us and partner with our Thurston County Public Health and Social Services staff and community volunteers, as well as our Medical Reserve Corps members, to offer several pop-up testing clinics that we offer each week. And we offer those to people in the community that may otherwise have difficulty accessing testing elsewhere. There are many other places in both public and private healthcare settings that can offer testing for COVID-19. And we encourage people to get tested as soon as they have any symptom of COVID-19 or concern that they may have been exposed to COVID-19. And Dr. A will may expand on that shortly here. We are seeing some delays, as I reported to you this morning, in our laboratory capacity and the turnaround time to receive those results. When anyone is ever tested, they are advised to quarantine until they have a result. So overall, we continue to monitor how we are doing with testing, and that is an area that we need to continue to improve and expand upon. We are working closely with our business community on safe reopening and safe operations of businesses that are eligible and activities that are eligible in phase 3 of Governor Inslee's Safe Start Washington plan. We are available to provide technical assistance and answer questions to people who may have concerns either around compliance or what they need to do to ensure that they are offering safe and healthy services to the public in accordance with state law and guidance. And I think with that, many other things that we have going on, most of our department's work has been dedicated to COVID response for these last 160 days. But I will pause there and allow Dr. Abdulmalik to add on.
Good afternoon, commissioners. I wanted to expand on what Director Slaughter has said regarding the rise in cases in our community. Many of the new cases are found in young people and children. As previously noted, many people can sometimes think that that children can't get sick from the disease, but a few children can get multi-system inflammatory syndrome, which is a fairly severe inflammatory process that's caused by COVID-19 that can affect the heart, lungs, kidneys, among other organs. While this risk is small, there have, as of the end of May, there were only 186 cases in the US. That number has grown to 300. The reason I bring this up to you today is just a reminder to all of us and to the public that, that even though the overall risk of severe disease and death in younger people and children is low, it's not zero. And so we highly recommend that everyone continue what they're doing in terms of wearing their facial coverings, social distancing, washing their hands, and covering their coughs. In terms of testing, we have been working with our case investigators and contact tracers to identify people who meet the criteria of being a contact. In this pandemic, that is being within 6 feet of an individual for more than 15 minutes. When somebody is identified as being positive, the Thurston County Public Health and Social Services Department will confidentially call them and let them know and ask that they be that anyone who has had contact that meets that criteria be tested. It's really important during this period, even if you don't have symptoms, to stay quarantined at home. So if you test positive, you will need to stay quarantined at home for 10 days, even if you don't have symptoms. If you test positive and have symptoms, it's important to stay isolated at home and for at least 10 days, or when you're fever-free for 3 days, 72 hours without taking medicines, and your symptoms have improved. If you test negative, but have been in close contact with someone who's had COVID-19, it's important to stay home for 14 days. It's following these recommendations that's gonna really help us curb the spread of COVID-19 in our community. We talk about the difference between isolation and quarantine. Isolation means that you're separating yourself at home, even from other members of your household. Quarantine means that you're staying within your household. Just to clarify, anyone who has tested as COVID positive should be isolating even from members of their household who are not COVID positive. We are working very hard with our contact tracers, case investigators, and our whole team to talk to people who have gotten COVID-19 to see how they got it, what exposures they may have had, and to use all of that information to make a Thurston County specific COVID-19 response. In addition to all of the guidelines put forth by the state and from our national government as well. I'm happy to. This is a challenge unlike any that any of us have seen in our lifetime. But I feel very confident that we can together work through all of this and come out the other side healthier and happier. I invite you to have any questions.
Questions for Shelley or Dr. A? I see Commissioner Hutchings' hand.
I have a few questions, but they're very simple, fill in the blank. I think a week ago we heard the average age or the mean age was 37, but now with the age group plummeting, has that dropped as well?
You know what? I don't actually have that number for this week. I will. Okay. I'll be happy to update you once we have the data from this week complete.
Thank you. Do you have that, Shelley? No?
I don't have the median age,
okay.
but I will share in just my review of the latest statewide information that 38% of the cases statewide right now are impacting people aged 20 to 39. And so that has been a dramatic shift from when this pandemic began here in Washington State. And the majority of cases that we saw were in adults above age 40, with the majority being in the high risk category. So very significant change in our statewide demographics in terms of age. Gender has been relatively stable.
And you said the PPE for hospitals, the PPE and staff are adequate. Is the hospital capacity adequate or dodgy or what? How would you describe the capacity with the ICU beds almost full?
The target metric that we look at is ensuring that we have at least 20% surge capacity available, and that our general non-COVID bed capacity is less than 80%, or excuse me, that 80% occupied. As of today, our hospitals are quite full. So in phase 3, most surgical and general procedures and healthcare services have resumed, and people are out and about, and that means more and more people are accessing the hospital emergency department and needing care and catching up on care that they may have delayed during the stay home, stay healthy time period. So our hospitals are very full. It's one of the reasons why we look at that every single day, and we meet very frequently with our hospitals and check on how they're doing and looking at the census.
2 more questions, and I'm done. You said the state stat was 41,000. How much? I didn't get the last 3 numbers.
757.
757, thank you. And the final question is, when it comes to congregate care setting, you keep close track of that, and I can't think of a bigger congregate care center than JBLM. So if somebody a soldier, or that works at JBLM, especially a soldier rather, if they live off base in Thurston County and they contract COVID, do they quarantine at JBLM, but we get the stat, or how does that work? I'm sure the JBLM will want the soldier on base, I'm presuming. How does that work?
Dr. A, do you wanna share information about that?
Sure. So we have a very good working relationship with the folks at JBLM. Usually if a soldier is COVID positive and lives off base, they quarantine in their house. JBLM will share with us some of their case files and contact tracing that they do. And if there are any, if there are any questions, if specific, contacts need to be followed up, we take over that as the county. But we have a very good working relationship to make sure that each member of our community, whether they work at JBLM or within Thurston County in other facets, has the same quality of contact tracing and case investigation, as well as the same isolation and quarantine instructions.
Okay, thank you.
Just as a follow-up on that particular answer, I happened to talk to a doctor from Fort Lewis the other day, and if they need treatment, they'll go to the Madigan Hospital. And I don't know that, I don't think we're getting, are we getting that count? I don't think they're letting us know if they've got 5 or 6 that are under quarantine. I don't think we're getting that notice, are we?
Yes, we do.
I think there's a discrepancy there because we got some specialized units out there, and I don't think they let that information out. So I'll just let it go at that. Maybe you do, okay? about 75% of the hospital beds are utilized by scheduled activity though, aren't they? And so that could be changed within a day or two, you know.
Elective surgery?
So, yeah, elective surgery. So that isn't quite as critical as it might appear to be. I guess I do have one question in regard to the 39 residents that we've had hospitalized. Are all of those 39 hospitalizations residents of Thurston County, or are some of those from Grays Harbor or wherever?
So a couple things, Commissioner Edwards. Of the 39 cases that we have reported hospitalized, those are Thurston County residents.
Okay.
They may have been hospitalized in hospitals outside of Thurston County, but all of those, that's Thurston County data that we share.
Okay.
In terms of a couple other things that you just shared regarding JBLM, we do monitor Thurston County residents that are hospitalized at Madigan Army Medical Center, and we do have access to that data on the statewide health system, the statewide hospital tracking system called WA Health that we take a look at. And so we are notified of that, and that's what I was referring to. And like Dr. A shared, we work in close partnership with JBLM on investigations and contact tracing regarding active duty and dependent military members. And I think there was one other thing that you said, but I lost track of that. If you have any other further question, happy to answer.
No, but just take it with a grain of salt, because the readiness requirements, that information is not divulged outside of that readiness core. So just take it with a grain of salt. That's all I'm saying. Underlying conditions. I'm wondering about, of the 39 residents that were hospitalized. I don't know how many are in there today, but we've had 5 residents that died, and it's my understanding that all of them have had very serious underlying conditions. But I'm wondering about the other 39 that have been hospitalized. Did they all have underlying conditions, or 90% of them did, or what's the gig there? Do you have any idea?
100% report having at least one underlying medical or health condition.
Okay. Then what's been about the average stay for those 39 people? I mean, I'm sure we've had some that went in for 2 days and got out, and some probably that were there 6 weeks. I don't know the answer to that, but I'm just saying, generally, what are you seeing there as far as recovery within 2 weeks or a month or days? What's the deal?
I don't have average length of hospital stay, but I can say that we have had some patients that have been admitted for a very long time. Oftentimes with COVID-19, and Dr. A, feel free to chime in, especially as a recent emergency department physician, to chime in on this. But when people are hospitalized, they often need respiratory support, and sometimes, and that means they are in the intensive care unit, and they need a lot of care and tend to be once they are on a ventilator, on it for a pretty long time. Dr. A, do you have anything kind of more to add on to that?
So yes, I agree with everything Director Slaughter has just said. Patients who have COVID-19 do have fairly variable disease, even amongst people who present to the hospital and meet criteria for hospitalization, meaning that they're severely hypoxic or having other signs of organ system failure. There are a number of approaches that are being developed by critical care physicians and ICU physicians around the country. Actually, they're all collaborating pretty well regarding best way to give oxygen, prone positioning, where patients are placed on their stomach to increase their lung capacity and to try to avoid intubation. Once a patient is sick enough to require intubation, which is when a tube is passed through the mouth into the trachea and provides air to the lungs and is connected to a ventilator, that process can take a week to several weeks for patients to heal enough to come off of the ventilator. So we're finding that patients who are sick enough to require mechanical ventilation do take a long time to get better. But we're still, this is a brand new illness, and we're still finding better and better ways to take care of patients who suffer from it.
One more question maybe. On tracing follow-ups, oftentimes you will ask citizens, because they've been in close proximity or exposed to someone that has now been diagnosed, you ask them to go in and take a test, even though they don't have any symptoms. Do you have those folks test positive on occasion, even though they have absolutely no symptoms?
Yes, we are seeing positives in family clusters, even when someone has no symptoms or the symptoms are harder to recognize, such as in young children who might not present quite the same way an older person might. The key to testing all contacts is to give us an idea of what the rate is of asymptomatic spread and pre-symptomatic spread in our community. And that'll just give us a better idea of how many people are truly affected. But yes, to answer your question, we are seeing asymptomatic patients test positive.
If you just had to take a guess of those that have ended up being diagnosed with, say, the 412, how many of those, maybe a percentage-wise, would you say show almost no symptoms or very, very mild symptoms?
So that's a little bit complicated, because until recently we were the guidance was that you had to have at least one symptom to get tested. So we were testing people primarily who had at least one symptom of COVID-19. We do see some variability with people having, a sore throat or a runny nose or something that could be confused for them with their seasonal allergies, who end up testing positive. We are in the process of looking at the CDC prioritized symptoms, so fever, cough, shortness of breath, to see which of these symptoms are the most prevalent, as well as several other less common symptoms, such as diarrhea, runny nose, and kind of the broader constellation that the CDC has grown their possible COVID-19 symptom list to include. So at this time, I don't have hard numbers, but when I do look through the files, which I do on a weekly basis, I do see a broad variety in presentation and symptom severity.
Okay, thank you.
My question is for Shelley in about contact tracing. So we had, at the point where we moved to phase 3, we had a recommendation, I think it was 40, 45 contact tracers. That was the state recommendation based on a case count of, I think it ended up for our population to be like 74 per week or something. So now that we've crept above that, let's hope that trend doesn't continue. But if that trend continued or even crept a little higher, do we then need to, my question is that, do we then need to add more contact tracers, and do we have the funding? Did we allocate funding in the CARES money that we allocated to your group to cover that expense if it in fact becomes needed?
Yes, Commissioner Menzer, you are correct. Our application for phase 3 required us to demonstrate that we have sufficient public health capacity in terms of the number of full-time equivalent case investigators, as well as contact tracers, and those providing case management to help people stay in isolation and quarantine. The threshold for disease investigators and contact tracers for Thurston County's population is a minimum of 43.5 full-time dedicated staff and volunteers. We currently have 44.5 FTEs trained and ready to go to investigate cases and to help assist with contact tracing. So we did allocate, the Board of County Commissioners, did allocate funding from the Coronavirus Relief Fund, also known as CARES Act funding, to help us increase the number of employees to help us with that. Because as I mentioned, we have relied heavily, and we're so very grateful for Medical Reserve Corps volunteers and other community volunteers that help us in this effort. But we need to have sufficient core staffing in order to meet the timeline requirements and manage these high caseloads, which we somewhat expected in phase 3, with more things being, more activities and businesses being opened. So long story short, we do have enough staffing. We just finished a recruitment to hire 36 more positions. Of those, approximately 11 will support our case investigation and contact tracing. So we're really excited to have fresh new team members join us. We do offer regular contact tracing trainings for volunteers that would like to help us. And I expect that as this pandemic continues on into the fall, that we will continue to need more and more assistance in terms of staffing to help support these kind of levels if we continue to see this in our community. We do 7-day-a-week investigation and contact tracing.
Are these folks? Thank you. That's a good complete answer. Are these? And I didn't know those details. Are these folks like? Do they work in the field at all times? Do they need to have a desk somewhere? Do they check in at the EOC? Like, how do we manage another 36 employees and 11 contact tracers?
And that's a really great question. We're currently trying to figure that out. Our disease control and prevention team that is responding to COVID-19 operate primarily out of our Lily Road facility. And some elements of this work can be done remotely. We are currently onboarding new technology to help us be able to do that long term. And the state has also given us some great tools in terms of helping to assist with contact tracing via a texting application called Sarah. So we're using technology to help us in this response. So not all of the work necessarily requires in-person interviews. A lot of it is done over the phone, but primarily from our Lily Road facilities where this is happening. And we will likely need additional space, because here in our facility, we have in our organization, we have over 100 employees, and we are also strictly adhering to physical distancing requirements. So we need to have adequate space here for our employees and volunteers to safely do this kind of work.
Thank you. That was it for me. Any follow-up?
I do have a follow-up. Go ahead.
Mitch?
Well, just based on, as follow-up to what you were asking about, my question is, Shelley, with all the number of businesses, nonprofits, government can't get along or can't do the job without volunteers. They donate hundreds of thousands of hours. So my question is, with all the volunteers that you have, when we have Memorial Day, 4th of July, moving into the fall or Labor Day, you can't force a volunteer to come in. Does this leave you shorthanded at the last minute when you're trying to get staff to cover an increased load of testing?
It can. We're so fortunate that our volunteers are very dedicated, and our Medical Reserve Corps in particular, they make a commitment to support us, and they've made full-time commitments to us, and we're really grateful. But yes, life does get in the way, especially now that we are in phase 3. Some of our volunteers have returned to other work and other obligations, and so we have to do a continuous volunteer recruitment. And yes, during holiday times, that does present a strain. This last weekend, we're really grateful that we had additional public health and social services employees come in, work overtime, and help to investigate cases and do contact tracing. So it is important that we have enough employees or FTE staff that we can rely upon to do the work, and then supplement that with volunteers. Really happy to have more people join and take the training to help us in our volunteer efforts, because it's definitely takes a village, and it takes our entire community to help us with this kind of response.
Right, that's good information, and maybe a deeper discussion else some other time.
Yes, sir.
Commissioner Edwards.
Going to deeper discussions, I guess. I don't know what your metrics are when you're keeping track, and how you're keeping track of all the different contacts and interactions that you're having out there with, especially say those, well, I think there's about 17,000, it looks like, that you've tested, or getting close to that. So I don't know what information you're gleaning, how you're recording it, how we might be able to assess some of those numbers into a question that I've got for you here, or if even you can do so. But I think it would be interesting to know, for those people, the doctor mentioned that so many of the people that we test, they come in on their own and they have some minor symptom, or maybe several, but the majority of them are testing obviously negative. But I'd be curious how many people that come in and test because they were contacted by a tracer, for an example, or they knew their cousin or something was tested and tested positive, and they knew for a fact they had been in close proximity and probably exposed, but yet they had absolutely no symptoms. And even maybe the same household. I would really like to know the percentage of those folks that come in with no symptoms and test positive, so they end up, they're being truly asymptomatic. And it might give us a sense of, at least for me, it would certainly give me a sense of the risk that people are exposed to on a daily basis under differing conditions. So I don't know if you have the ability to get that information, or get it in the future for the next 20,000 that we end up testing. I don't know the answer to that question, but I think that'd be valuable if we could come up with that information.
Thank you, Commissioner. I have been looking at our case tracking sheets since I started here on July 1st. I've gone back as far as about June 22nd. Because the symptoms of COVID-19 are so broad and multifaceted, up until this point, almost every positive case has had at least something, and it's very hard from looking at a case file to gauge severity, because looking at a piece of paper isn't like looking at a patient, is what I realized. now that we're going to be testing and making a formalized push to test asymptomatic contacts, so people who are at high risk of having contracted COVID-19 but have not yet expressed symptoms, it will be our data pool will be much more robust, and I will continue to track who has symptoms and test positive and who remains asymptomatic and positive. Thank you, Commissioner.
Are you asking for blood type on some of your analysis questions?
At this time, we aren't.
Why not? Or could you? Or maybe most people don't know. I don't know.
So the issue would be one of logistics, because the COVID-19 swab is a swab and the blood draw and the blood type is a blood draw. Usually if people are just coming in for COVID-19 testing, they would not be also drawing blood at that time. But I agree with you that with some of the data that's been coming out that suggests a correlation with disease severity and specific blood types, I agree with you that it would be interesting.
I wouldn't doubt that a lot of people that donate blood or have served in the military, that type of thing, I would guess they know their blood type. So, I mean, it wouldn't hurt to have the question there on the form, you know, what's your blood type? Do you know? No, I don't know, or yes, I do know. Be kind of interesting.
You might be wrong.
It could be, but the majority would probably be right. You look at, I remember it all the way back from my dog tag days. That's more 55 years ago. And it never changes, I'm told.
That's correct.
Okay, let's wrap up this item. If there's any, I think it's great for us to have this longer discussion. We have check-ins every Tuesday morning, but as Commissioner Edwards pointed out, and the public, you know, and Dr. A should be aware, the board just doesn't get to have this kind of like lengthy discussion with our health director together outside of this public forum. So we have to take this opportunity. So that was a good opportunity to do that. Item 7 on the agenda is Board of Health members' health-related activities. I think being a county commissioner the last few months is a health-related activity, in my estimation. But if there's any specific things that my seatmates would like to report, now is the time. Commissioner Edwards.
Well, I reported on my problem out in the Yelm area at our regular board meeting, and I really think this is going to heat up as a community issue. I think it's going to be very similar to that group that wanted to put the sewage on the property next to the river, where we had these community meetings and a lot of intensity on that issue. I don't see an infrastructure in place out there to support the proposed activity. And I can't imagine this place even passing any kind of inspection. I mean, they're going to have to do a substantial remodel. That building was built in 1930 as a bunkhouse for mill workers. And it's right there susceptible to major flooding that causes us a lot of problems from emergency management standpoint. Since I've been around, we've vacated that place probably 10 times because of flooding issues. I can't imagine the tribe is going to be thinking that's too good of an idea for water quality issues. I don't know. I see a lot of problems coming, and I'm just reflecting what I'm hearing from the community that's kind of been nonstop on my back for about a week now. So I'm sure the rest of you will probably hear something about it as time goes on. So I'll just let that be my report. Thank you very much.
Mine is short and sweet. I cut out a lot because this has gone on for some time. But this one talks about social services involvement. And last year we reinstituted one of Thurston's Thrive initiatives called Partners. And Partners is children, youth, and families. So nonprofits and government and faith-based people come together, and everything surrounds children, youth, and families, and help them survive and thrive. Component is Thurston Youth Alive, which is suicide prevention for youth. Opioid Task Force. We get someone from the Opioid Task Force that reports to us, and other various nonprofits. But what's interesting is COVID-19 and the mental health piece. comes into every faction of children, youth, and families when it comes to suicide and thriving and the various stresses and such. So I attended one last month, or I chair it last month, and we just had an agenda setting last week, or just last Monday, and the next youth or the next partners meeting is this Thursday morning. So that's about it for my social services involvement at this point. Thank you.
Thank you. And I'm not going to say much. When I volunteered to chair the Board of Health this year, I thought I would be chairing a lot of meetings and working on our emergency declarations on homelessness and opioids, which I've tried to work on over the course of last year. And it turned out that I have not chaired any meetings really. And I've been working on we've been working on a health pandemic that I knew really nothing about prior to this year. So it's been quite an educational experience for me to learn about how something like this is managed. And I'm very grateful to our former health officer, Dr. Yu, our director, Shelley, and all of the staff members that have just really made it, I've had to go to report to the community on what Thurston County is doing, and I always have a long and very impressive sounding list of activities to show how we're responding to this. And the numbers, I think, have shown our success. Although we still have, as Dr. Yu kept saying, this is a marathon. And I think we all kind of wished it was a sprint to July, to phase 3. And then we'd just be kind of downhill from there. And it's not looking that way. I'm really concerned myself about schools. Next year, I've got a 8th grader headed to high school, and I've got a 6th grader headed to 7th grade. And I just want to make sure we do the right thing for the community, to get schools, to get our children, back to the whatever learning model is going to work for them in the best way possible. So that's what I'm focused on in terms of health-related activities. I'm going to turn it to the next item, the health officer's report. And I'm going to preface this by saying that one of my pet peeves is about the news media. I think it's about society right now, and I think it's exacerbated by the way we digest news, is that it seems like everything just shifts from one shiny object to the next shiny object, and then that's all you hear about. And it's like every other thing that you were working on just kind of drifts away. Nobody hears about it. So typically our health officer's report is wide-ranging based on things that Dr. Wood, for example, was working on. And I know you've been immersed 24/7 in COVID-19, but feel free to report on any other issue, another area, maybe give a community a heads up as to another area of interest that you have. Maybe you can't work on that thing right now because you're so busy, but maybe something you might want to work on for the community in the next 12 months if we ever get past this. I would love to hear something like that. Something non-COVID related.
Thank you. So one of the wonderful things about working here in Thurston County is all of the varied activities that we do for the public. One of the things that has captured my attention as an emergency physician is our opiate response task force, and I was fortunate enough to attend a meeting. I was impressed by the level of community engagement in the task force, and it seems like an important challenge for the county that I would like to help work on in the future. There seems to be a lot of efforts already underway, including a syringe program that I hope to build on and continue to work with our community to address in the coming days and months. The other things that I have been fortunate enough to be thinking about within our context is there's some people working on emergency preparedness in a broader sense. As an emergency physician, that interests me, just making sure that we're prepared for the next disaster that might not be a pandemic. So thinking about emergency preparedness, as well as maternal and child health, which is always so important within a pandemic and outside of it, and vaccinations as well. Those have all been projects that I've started thinking about and working with our respective members of our department on.
Thank you. Any questions for Dr. A on issues outside the context of COVID-19?
No, sir.
No?
Okay, very good. I'm going to turn it to our last item for today, which is Director's Report. Shelley Slaughter.
Thank you, Commissioner. I will actually follow in that vein and share some things other than COVID-19, but I do just want to take this opportunity to say that yes, for the last 160 days, our department of over 100 employees has been working together on this response. We've had over 50 staff from public health from various programs of our department, as well as within the county, and in addition to all of the community volunteers and our nonprofit and healthcare partners that have helped us in the response. And it's been amazing to see everyone step up and help and done an amazing job and worked really hard under difficult circumstances, not only in our professional world as dedicated public health servants, but also in keeping safe and healthy and caring for all of our families in the community as well. About half of our staff have teleworked from home, but 100% of our staff have been working 7 days a week, sometimes 24/7 around the clock, to continue to provide foundational public health services, as well as support services, human services in our community in several different areas. So they have just been amazing at continuing to carry out our mission in Thurston County Public Health and Social Services Department, which is working together to achieve the highest level of health and well-being for everyone. And so they, every day, in addition to addressing the COVID-19 pandemic and perhaps serving on our incident management team or in another role, have continued to address over 100 other notifiable conditions, continue to make sure that people in our community have access to clean syringes, as Dr. Abdimalik stated, and access to things like Narcan and hepatitis A and HIV testing. Our nurse family partnership team has continued to provide hundreds of visits to high-risk mothers and their young children, pregnant parenting, people in our community in need via telehealth visits, ensuring that they have their basic needs met, delivering food, diapers, and everything else that people need in the community. You hear regularly from our amazing housing team, continuing to ensure that our homeless response system is strong and that we have adequate shelter and supportive services for that population, access to treatment for those with behavioral health and substance use issues. Our environmental health team makes sure that as all of us at various stages throughout the phases have ordered food online, or now that restaurants are serving, continue to make sure that we all have access to healthy food that is safe for everyone, and inspect various restaurants and recreation facilities. They work really hard, and the demands on that group are even greater now with additional requirements to monitor. They ensure that our drinking water is safe. Our water lab has continued to operate for our community, ensuring that people have access to drinking water. You heard earlier in the agenda some of the work that our staff do in monitoring our recreational waterways, our lakes, ensuring that they're safe, that we have access to sanitation and hygiene, continue to work on our septic, evaluating our permits and issuing those. So, I mean, I could just go on and on about all of the amazing things that our staff continue to do every single day to protect the health of our community. I'm really proud. They deserve so much credit for everything that they do every day. And this, one of the things that has been positive about this this emergency has really highlighted how critically important the work of public health and social services is to a community and to a nation, and how key it is to our economic vitality and our safety and well-being. So thank you to you as the Board of Health for your leadership during these challenging times for our community, and for the support that you've provided to all of our staff. So thank you.
Thank you, Shelley. Anything further for Shelley?
Thank you.
With that, we're adjourned.